evening, and thank you CSRBOX and Bhomik for inviting us here. I represent the Dr. Shroff Charity Eye Hospital, which is a 100-year institution in the heart of Delhi, housed in a heritage building. We know blindness affects everyone, and India, among all the gloom that we hear about, has done actually very well in blindness. The blindness prevalence has reduced in the last 20 years from 5.3% to 1.9%. While we've done very well, our population continues to grow, and we still have the highest number of blind in the world. And in the country, about 9.2 million people are blind. The institution started 100 years ago with a mission to make a lasting impact on the eradication of blindness and deafness for all socioeconomic people in the society. It was inaugurated by Viceroy Irwin. Mahatma Gandhi, Rajendra Prasad have been here as patients, and more recently, Dr. Kalam underwent surgery here. We are the tertiary care hospital at Delhi, and we look after communities in UP, in Uttarakhand, and in Rajasthan through surgical centers, and then further beyond, villages are looked after by primary care centers called vision centers, and there is door-to-door screening. With that, we offer cutting-edge solutions for people who come to us, and we are rated among the best eye hospitals in the country, and we take pride in the fact that we treat the penniless and the presidents. 50% of the work that we do is completely free for the very poor. If you look at healthcare, and eye care is no exception, these are the 4 ailments that we have. Access is a huge concern, and unfortunately, where you're born determines how healthy you are. Of course, it's because of lack of services, limited resources, and poor human resource. At Shroff, we manage this by having our tertiary care hospital, which not only does subspecialty work, but education. We create healthcare teams, quality assurance, and research and central controls. These surgical centers are largely cataract hospitals, which are dotted by vision centers, which are manned by technicians who look after recognized conditions. They are able to detect common ailments like cataract, glaucoma, and urgent conditions, refraction, and then there's a referral to the hospitals. But we realize that even when we open primary care clinics, within 5 kilometers, people are not aware of it and are not accessing them. And so we do a lot of door-to-door screening with an app where our healthcare workers go door-to-door and examine patients for vision and eye ailments. So this is how the network works. You'll happy to know that 80% of the staff is local, and more than 70% of the staff is women. In the last 18 months or so, we've screened over 3,000 villages, and 2.4 million people have been screened door to door. So there's a lot of emphasis on primary care, almost 30% of our patients, and last year we screened 2 million patients door to door, and 35% of the surgeries that we did were referrals from the vision centers. Without human resource, this is not possible, and we all know that we don't have doctors and paramedics at the right place. 75% of the ophthalmologists in the country are in 9 cities. So we create healthcare teams, we train doctors, and the way we train them is that while they are getting trained, they serve in our surgical centers, of course under supervision, and at any given time we have about 100 odd doctors in training. The impact of training is that we have created healthcare teams not only in India, but in Indonesia, Mongolia, Nepal, Bangladesh, Vietnam. Allied health workers have become the backbone of any healthcare service. India is woefully short of allied health workers. We have a program where we train young women as eye care paramedics. In the last 7 years, we have trained and recruited more than 1,500 young women. These are 12th grade educated women who are trained over a 2-year program as eye care paramedics. They are from the areas where we are in UP, in Saharanpur, Vrindavan, Shahjahanpur, in Rajasthan, and Alwar, Meerut. And as you can see, as we have increased the number of allied health workers, the number of surgeries have exponentially increased. So in the last 5 years, we've moved from something like 28,000 surgeries to 60,000 surgeries. Why women? If you educate a man, you educate an individual. If you educate a woman, you educate a nation. And we were talking about technology. I think technology without a technician is useless. You need a person on the other side. And these women become the enablers. For example, this ulcer on the cornea, which is a sight-threatening condition, is noticed by a healthcare worker. Again, these are women healthcare workers who have an app through which they can screen vision and detect common conditions. The patient is taken on a simple e-rickshaw to our vision center. They work within 5 kilometers of our primary care center. A vision center has a technician who's a young lady trained by us, 12th grade educated, who has a slit lamp, can do a refraction and refer through teleconsultation. All these are linked with electronic medical records and seamlessly they reach a hospital. This patient is referred to the nearest hospital in Shahjahanpur, where a lab tech, again trained as a young woman, is able to detect that this is fungal ulcer. A corneal tissue reaches the place and a doctor trained by us is able to perform a corneal transplantation in a place like Shahjahanpur. We work on a cross-subsidy model. Patients who can afford to pay come to us because of the quality of service, and with that we are able to meet our running expenses. Task shifting, economies of scale help us to reach out to more people and sustain this whole operation. Of course, we look out for philanthropic grants and CSR grants for capital expenditure, while the operating costs we are self-sufficient. Without quality, this is not possible, and there is extreme degree of monitoring of how the patients are doing and how the vision is improving. And all the operations have a quality assurance system built in. Going forward, by 2030, we would like to do 150,000 surgeries, treat 1.5 million patients annually with over 150 vision centers. We recently had a strategic plan, and we are very conscious of our responsibility and the next phase of our development. Vision is extremely important for the Sustainable Development Goals, recognized even by UN. And all this work helps in reducing poverty, improves good health, quality education can be provided, and I think healthcare is a great place for building livelihoods. Gender equality, as we see, over 80% in our secondary centers, vision centers, are women. We are able to provide livelihoods, reduce inequalities, sustainable cities, because treatment can happen locally. People don't need to travel to big cities for treatment. And without partnerships, this is not possible. We are fortunate that a number of CSR groups as well as INGOs work with us. Thank you so much for having me here. Thank you.